Hello, Miss Rice. How are you?
Good, how are you?
I'm fine. So what did you come to see us about today?
Well, I've been experiencing dry cough,
Mm-hmm.
chest pains, shortness of breath,
Mm-hmm.
weight loss, and a decreased appetite, and I have been experiencing night sweats.
Okay. And how long have you been experiencing night sweats and decreased appetite?
For just about 10 months.
Okay, and I see here in our records that you had breast cancer.
Yes, I had it 8 years ago. I've been breast cancer free.
Uh-huh. And you had 2 reoccurrences. What did they treat you with?
Radiation therapy, 6 weeks.
Okay, okay.
Each.
Well, I'm gonna have Dr. Burley come in and examine you, and then we'll try to figure out what's going on.
Okay, thank you.
Mm-hmm.
Hello, Miss Margaret. How are you?
Good.
My name's Dr. Burley. How are you today? Okay, well, I was asked to administer an x-ray on you to, we're gonna have you put on the lead jacket, and we're gonna put you in the x-ray room, and it's gonna be an easy procedure, okay? Alright, so let's get you in the x-ray room. Hello, ma'am. We're gonna have to take some blood today for further testing.
Okay.
Let's clean your skin real quick. All right. Hold still. Okay, we'll be back.
Thank you.
Miss Margaret, we're gonna have to keep you for further testing. Is that okay with you?
Yes, it is.
Okay, come with me. After you. Hello, Mrs. Rice.
Hi.
How are you?
I'm alright.
Feeling all right?
Yeah.
Mrs. Rice, your chest x-ray came in and we're seeing cloudy areas around your lungs indicating pleural effusion, which is a buildup of fluids in your lungs.
Oh my, so what now?
We want to run a couple of tests on the fluid. We'll have to perform a thoracentesis, which is a procedure where we extract the fluid from the lungs so that we can determine the cause of the buildup.
Is this the only test?
I'm afraid not. We need to do a CAT scan to show exactly where the abnormal region is.
So how long would these testing last?
It might take a couple of days, ma'am. We'll have to do a couple of tests. So we'll need you to sign some documents so that we'll be able to perform the test on you. If that's okay. Just sign here, and here, and also here. Thank you.
You're welcome.
And we'll be seeing you shortly.
Okay.
Have a good day.
You too.
morning, Dr. Hurley.
Good morning, doctor.
All right, so tell me about this new patient.
Her name is Margaret Rice. She's a 55-year-old Caucasian woman.
Mm-hmm.
She has previously, she had breast cancer, but she's been breast cancer free for 8 years now. She has had 2 reoccurrences, each time undergoing 6 weeks of extensive radiation therapy.
Mm-hmm. With any symptoms?
Yes, dry cough and wheezing. Chest pains,
Mm-hmm.
loss of appetite, weight loss,
Mm-hmm.
night sweats,
Mm-hmm.
occasional swollen face and blood in the sputum. She also has been retired for 5 years now. Before that, working on a shipyard for 15 years as a machinist, which could have exposed her to asbestos.
Good observation, Dr. Fair. Okay, and after examination?
When we performed the chest X-ray, we found that there were fluid in the lungs, and that was indicative of a pleural effusion, and also indicative of reduced chest expansion.
And do you have those results with you?
Right here.
I see where you have circled the pleural effusion.
Mm-hmm.
And you said it was indicative of what?
Of reduced chest expansion.
Okay. Any other tests you performed?
We also performed a CAT scan, and the results are right here.
Okay.
And that was indicative of a possible right side pleural mesothelioma.
And I see the line drawn here. For the pleural effusion, did we do a test on the fluid?
We did. We performed a thoracentesis, which we found that the fluid was cloudy, which was indicative of a lot of cells and proteins, and also revealed that the fluid was related to exudative pleural effusion, meaning by it was caused by cancer or other malignant conditions.
And the cells, where did they come from?
They came from the pleural, as well as the systemic circulation, which also indicated that it spread.
Any other tests, doctor? Blood work?
For blood work, we found that the red blood cell count was 100,000 per millimeters cubed.
Okay.
And the white blood cell count was 10,000 per millimeters cubed.
Okay.
And also her count for lymphocytes was only 50%.
And this is indicative of?
Indicative of obviously abnormal levels, which would be consistent with the malignancy.
Any other tests?
We also performed a thoracoscopy, which means that we had a biopsy, which revealed that there were cancerous mesothelioma cells, and this is...
This is the tumor?
Yes, ma'am.
From the thoracoscopy?
Yes, ma'am.
Okay. And you said mesothelioma cells?
Mm-hmm.
So it seems like this is a cancerous condition. All right, so possible diseases that are related to these symptoms in past history.
Lung cancer.
Lung cancer. Justification?
Just because of the cancerous cells that were found.
Dr. Levesque?
Maybe pulmonary embolism, and that's because of the reduced chest expansion that we found by the chest X-ray.
Few of her symptoms also could be indicative of tuberculosis, so we'll put that up there as well. All right, now we need to start ruling out these diseases.
I like to rule out tuberculosis because all of her symptoms aren't consistent, and with the thoracentesis results, which revealed that the fluid was exudative, causing pleural effusions, and that fluid was also more likely caused by a cancerous or malignant condition.
Adequate observation. Dr. Levesque?
After thinking, I think we can rule out the pulmonary embolism because when we performed the thoracentesis test, we found that there was no blood in the fluid.
And based on the fact that the thoracoscopy came back that the cells were mesothelioma and lung cancer and mesothelioma cells have a different pattern, I can only rule out that lung cancer is not one of the diseases. So, back to square one. Let's start connecting dots. Let's see, asbestos are related to all of these symptoms. The cells were mesothelioma related. And this proves that it's some type of cancer. Given that the cells are related to mesothelioma and that it is a cancer, I can only conclude that the diagnosis would be pleural mesothelioma. Now, although it's the most common type of mesothelioma cancer, it is a rare diagnosis, so this is a long shot. But we could provide her with treatment and see where it goes. So, possible treatments for the patient, Dr. Fair.
A pleurectomy, and here you will remove part of the lining in the lung in the area known as the pleura, which will help her with her breathing.
Dr. Levesque.
We could also do chemotherapy, which would help control the growth of the cancerous cells, and maybe even eradicate the cells as well.
And probably to be more effective, we're gonna have to treat that also with radiation therapy. Okay, is there anything else we could do to relieve her symptoms?
We could also perform surgery, but based on the fact that she had 70% reduced lung percentage, then more than likely her lung capacity isn't strong enough to allow her to survive.
Good observation. So, no surgery. So right now we're looking at a pleurectomy, chemotherapy, and radiation therapy, as well as other procedures to keep the fluid from building up. Correct? Okay, so how long do you expect that she will live?
Maximum of a year. Max.
Sure, well, only 10% of people diagnosed with pleural mesothelioma live up to 5 years anyway, and given her advanced stage of the condition, I'd give her a minimum of 6 months, and we're gonna set the max at a year. This is one of my hardest cases. It's sad to see such a homely old lady just pass like this. All right, doctors, well, it seems that all we can do now is treat her and see what happens. I guess I'll have to go give her the news and inform her family. I'd like to congratulate you guys on a good job.
Thank you.
At the fair. Put that on the back. Have a nice day. Hello, Miss Rice. How are you? So, we figured out what was wrong with you, and I'm sorry to tell you this, but you have pleural mesothelioma, which is a cancer of the chest, of the lungs, and it's really not looking too good for you, Miss Rice. Because it's in the progressive stage of the cancer, and because of your age and your debilitating condition, we can't really perform surgery to remove the cancer at this time.
So what are my other options for treatment?
Well, all we can do is relieve some of the symptoms, make you feel comfortable. We can do chemotherapy, radiation therapy, and procedures to prevent the buildup of the fluid. But other than that, that's all we can provide for you.
With this treatment plan, how long would I have to live?
Well, typically, individuals diagnosed with mesothelioma tend to live 4 to 18 months after the diagnosis, and only 10% live up to 5 years. So, with your condition and the progressive stage, it's looking like a minimum of 6 months, and if you're lucky with this treatment, maybe we can get you to a year or two.